stage. We have a group of panelists that are going to be taking us through this morning, and therefore I would want us to kickstart. So a very good morning to all of us. I want to introduce our first speaker, who's going to speak to us a little bit about Apollo Group, and her name is Irene Mutonyi. Irene Mutonyi is the Chief of Staff here at APA Apollo, and we would like her to come and take us briefly, just to tell us a little bit about Apollo, and then we will immediately kick in and hear our specialist talk to us about cervical cancer. So thank you so much. Irene, I want to welcome you. Please, you can unmute and take it over.
Thank you very much, Jemima, and a good morning to everyone. Welcome to the home of happiness, APA Apollo. I will just take you through briefly on some slides that will give you an overview of what we offer as we go ahead with the presentation before we get into the cervical cancer, the topic of the day, which is around cervical cancer with Dr. Owiti. So I request Jemima, if you can put it on slideshow. So APA Apollo is, we have three entities. We have APA Insurance, actually 4 entities: APA Insurance, APA Life, APA General, and Apollo Asset Management. Each of those arms is dealing with a different aspect of Apollo Assets. Is where we invite you to to venture into the money market and your investments. We have APA Life, where we look at all the life products, from retirement savings to your life insurance offerings and group life for the corporates. And then we have APA Insurance, which I think everyone is familiar with, and that is where you get your motor policies. But I will talk about some more of that because there's a lot more that we don't leverage on as clients in this case. And I'd like to just share more. Jemima, you can go to the next slide. So why Apollo Group? We pride in financial stability. We pride in also being customer-centric, and we also give you 24-hour round-the-clock support. And that's just among other things that we pride in. And you can count on us as a reliable insurer who will be there for you and in your time of need. We obviously do not want the risk to occur, but when it does occur, we stand in for you. So let's proceed. Jemima? Today, and the reason for this brief talk is we want to introduce to some of you, it might be new to some, you may already be familiar with it. We have an insurance program that is designed specifically for women. It's called APA Shield. And what we are saying here is that we recognize that women have unique needs. And this program is specially designed for you to create meaningful solutions to improve and protect your well-being at every stage of your life. We recognize that we may not have the time to dig up all the resources that are available within our network. And so we are providing a platform where you can come and listen and come and read about all the different offerings that we have. So APA Shield is designed just for that. And if you look at the next slide, you'll actually see that we have we have 3 pillars that we are standing on. We talk about health, we talk about wellness, we talk about your wealth and protection. And in each of these pillars, we want to be able to provide you with solutions that will guide you. And our prayer and our hope is that you could be among those women who are smiling, like we can see here. I know that this is very focused on women, but there are other solutions as well for men. So men, we are not leaving you out in this. It's just that today we are talking about cervical cancer. And so we thought we would take time to just talk about this program. Let's move on. So the pillars I've already talked about, and I will share more about what the offerings are. I want to just take a brief moment because all of us talk about insurance. But, we realize the value of insurance at the time when a risk occurs. But how about if we take a proactive effort to just sign up for a package that will protect you in your time of need? I'm talking here about health and wellness. We have Jamii Plus, for example, which will cover you and your family in the event that you're an SME or you're not covered in your corporate. There's a package for you. There's also a package for you as an individual. I'll not go through all the details, but I also want to highlight Femina Plus, which I will talk in more detail. We have PharmaFast. In the event that you have maybe a cold or a flu, you can go to a pharmacist. We have signed up with some pharmacists for a special program where you won't have, you will avoid all the waiting time in the doctor's office. You'll actually be able to get your medicine at a prearranged, with some prearrangement with some specific pharmacists who will actually deliver to you the drugs and you'll save yourself also the consultation fee. This is, of course, qualified pharmacists that we have signed up with. We've also got the protection where we are talking about products like education for your child, because you know that from the time they're 2 years old, they will need to go to university. How about you take a proactive effort and start saving at the time that they, from their early age all the way to when they go to university, and you find that you have such ease at the time of paying if you plan early. But some of a lot of times we may not be able to, because of all our business, we may not be able to see the benefit of it proactively. But what we're encouraging is come to this platform. We'll share with you some of the packages that we have that are geared towards ensuring that you and your family are at peace at the time of need. Let's carry on. On the next slide, I want to talk about Femina Plus. Femina Plus, Jemima, if you can go to the next slide. Okay, great. So Femina Plus is a very unique offering, and is the key purpose for just sharing with you a little bit about APA Shield, because under the APA Shield, we have this product, which is quite unique. And why do I call it unique? First, it is talking about prevention. In most cases, insurance packages will treat you after the risk has occurred. But in this case, we are encouraging preventive care. And we are saying that when you sign up for Femina Plus, you will be able to get a HPV vaccination. You'll also get free screening, and you'll also we hope that this would not be the case, but in the event that you are diagnosed during your period of sign up with us, if you're diagnosed with any of the cancers, breast cancer, cervical cancer, or no, there's one more, sorry, cervical cancer, breast cancer, we are able to take you through the journey as women, through the journey, and you're able to get a cash out payment, which you could use towards your treatment or for other needs. This is what makes it very, very unique, because you're not just taking care of your treatment, but we also recognize that you have out-of-pocket costs such as travel, accommodation, or other family expenses that come in the way. So you may even have your regular insurance program, and this would be a very good supplement. It covers women between age 18 and 60 years of age. And I just want to, on the next slide, to briefly talk about how much cost we are talking about. And this is what makes it unique. For as little as $500 a month, which is 6,067 a year, you can get the silver package, which allows you, for example, if you're diagnosed with stage 1 cancer, you would be eligible for 300,000 payout. If you are diagnosed in stage 2 cancer, it's 1 million etc. And you can see on the platinum side, for 15,000 a year, you are well covered for some good portions. And so this is a good plan and a good package to supplement your regular insurance, or even just to sign up afresh, because it will cover you as a woman and in your stages. And hopefully, as I said, this is not something that we anticipate would happen, but in the event that it does happen, this is a great cover for you and your family. I want to, as I said, this was going to be very brief, but it was just to give you a snippet of what we have. We have a lot of information about Femina Plus, about APA Shield on our website. And if you're interested in more information, please, you can either scan, there's a QR code that is showing on your screen right now. You can scan that, or you could also send a text to 0720-760-577. There might be someone who's driving, so I'll repeat that again, 0720-760-577. Just text Femina and someone will reach out to you with more details, or you could send us an email at on feminaplus@apainsurance.org. feminaplus@apainsurance.org. Otherwise, thank you so much. Thank you for trusting us as your valued insurer. And for those of us who are contemplating any packages, please feel free to reach out to our customer experience team. They're there and handy and willing to help you out. And we're there 24 hours round the clock. God bless you.
Thank you so much, Irene. We really appreciate your presence and also your presentation. I'm sure our viewers are very excited. We're very humbled to have you join us this morning. And once again, thank you so much. And as we allow Irene to leave the stage, I want to take this opportunity once again to welcome you again on board as we welcome our doctor. This morning, we'll be humbled to have Dr. Maureen Owiti. Dr. Maureen Owiti is a known or a renowned obstetrician gynecologist with vast experience in the field and has great devotion to women and their needs, especially in the reproductive area, which involves, of course, and where the cervical cancer would fall and most of the time attack. So Dr. Owiti, I'll not go to when she completed her university and all that. At the moment, we know she's practicing and she's actually graduated with first honors in several universities. Since then, she has gone on to work in different areas in this country, including most of the level 5 hospitals in Kenya. And through mentorship, Dr. Owiti developed deep interest in subspecialty of fertility, and she has worked with many couples to restore their fertility using various procedures, including laparoscopic surgeries. For those couples who feel they have achieved their desires or their desired family size, she also specializes in offering solutions for contraceptives. So she works both in the public and private sectors. She's currently based at Kenyatta National Hospital. She's also a lecturer at the University of Nairobi and also runs a clinic where she's going to tell us by the time she's through. So with that in mind and with her love for what she does, that is what her slogan, she loves what she does. I would like to welcome her on stage. I don't know, Dr. Maureen, can you hear me?
Yes, Zainab, can you hear me?
Loud and clear. Karibu
Okay.
sana. Yes.
If I can be allowed to share my screen.
You want to be allowed to share your screen?
Yes. Are you seeing my screen?
Yes, we're seeing your screen, but you need to expand it a bit.
No, I'm putting screen share, so just also. Is that better?
That's okay.
Okay. Thank you very much. I'd really just like to take this opportunity to thank the entire team at APA starting with Irene and Zainab, who has been a very good collaborator. I'm one of those, I just like cracking jokes. They are saying they're a good insurer. I can tell you my debt collector does not knock at their door so often. So that, I think, for me, also indicates that they're actually a very good insurer. Today, I think we're talking about a very interesting topic. We're in the era of prevention, and I'm very happy with the product that Irene gave us a brief about. I think I should be one of those people that I also joined the bandwagon on getting that because I think we are all aware that, unfortunately, if you do get cancer, it's the cost of care is very prohibitive, and it's good that we're going to be able to have something that's tailor-made to assist women should the unfortunate happen. We're in January. January is Cervical Cancer Month. Ribbon for cervical cancer is interesting. It's ish a teal. Teal is a greenish color with a bit of white on one side, though I think for reproductive tract cancers, our color is green. So, and it's this particular green. So I think it's good that it was just opportune that APA thought it fit that we spread awareness about cervical cancer to our clients. So what is cervical cancer? Cervical cancer is a type of cancer that occurs in the cells of the lower part of the cervix. And we know it is a sexually transmitted infection and caused by what we all know is the human papilloma virus. So I think Irene mentioned about getting the vaccine. That vaccine is against the papilloma virus. So just so that we're clear about what we're talking about a very, very tiny organ, the cervix. At most, in people who have very long cervixes, it's less than 5 centimeters. So I hope you can see where my laser pointer is at. It's that area. So just a reminder about our reproductive tract. So these are the internal reproductive organs. You have your vagina, then you have the uterus. So the cervix is actually the mouth. Cervix actually means neck, but we call it the mouth of the uterus. You have another cervix, that is, your neck is actually called a cervix. So sometimes it's very interesting when you have orthopedics and gynaes together, and the cervix they have in mind are very different places. So again, just a reminder, you have your ovaries, you have your fallopian tubes, and this is the uterus. So the area that we're interested in for this particular talk is the cervix. So very interestingly, we need to know the stats. So what are we talking about? And it's very sad that in this day and age, 2022, we're in the era of vaccine, whereby a lot of people are covered by the vaccine, and we are still having cases of cervical cancer today. So it's very challenging. It's very challenging when that we have 660,000 new cases that was reported in 2022. It's the 4th most common cancer. It ranks after breast cancer. And not that we're talking about cervical cancer. We normally do screening for breast and cervical cancer together. So I'd just like to remind people that people think that breast cancer is for women only. Men are also affected by breast cancer. So it would be good if all of us get screened for breast cancer. But let's go back to our topic. And the next common cancer is colorectal cancers and lung cancer. Unfortunately, cervical cancer is the leading cause of death. So we have more cases of breast cancer, but more women die because of cervical cancer. What's the status in Kenya? You find that in Kenya, it contributes 12% of all cancers. And we have 3,200 deaths 2020. This was according to a research done by the Cervical Cancer Program in Kenya between 2011 and 2020. And what is shocking is, unfortunately, despite efforts done by the ministry, the uptake of screening is very, very low. We're still at around 16%, and that's sad because I have interesting facts about different cancers. If I were to get a cancer to be given a choice, I'd ask breast cancer. Reason, breast cancer, you'll see a patient 20 years down the line from treatment. Cervical cancer, you're unlikely to see a patient 20 years down the line unless they were caught very early stages. I was very happy the other day. I was on one of the media stations and I met an old patient of mine whom we operated in 2016. And she was fortunate because we found her at stage 1, and that's why she's still with us today. The moment we're getting you stage 2, especially above a stage 2B and above, the likelihood that we're going to have you with us in 5 years' time is very, very slim. But we thank God that there are advances in terms of treatment. So we're hoping that those statistics are going to change. I think I would ask a question. I don't know if I can see the participants because I'm projecting at the moment. Can anyone, I don't know if there's anyone or other participants able to talk? Zainab?
No.
If we, they're not able to.
Unless
so, okay, I'm also not able to see the chat at the moment. Let me just check. So I'll ask if, who knows who this lady is, if they can write in the chat quickly. Okay, so wow, Richard, so we have everybody. And I think why everybody is able to reply is this was an icon. We grew up watching Catherine Kasavuli, the most eloquent and beautiful person I've ever seen, and may her soul rest in eternal peace. And for me, as a healthcare worker, this is very, very sad. This should never have happened because, again, the interesting fact about cervical cancer, unlike majority of cancers, it is preventable. Very few cancers can you say we can prevent the cancer. So if we can use her, not so much just to spread awareness and remind people, can we go for our screening? Can we go for our prevention programs? So I've mentioned that it's caused by the human papilloma virus. It looks very much like your coronavirus, which most of us are now aware of because of the pandemic in 2020, 2021. And we know there are over 100 different types of these viruses, and about 40 of them can infect the anogenital tract. And we have we have over about 14 high-risk genotypes. And when we call them high risks, it's because they are going to cause progression to cancer. The most high risk is always HPV 16 and 18. So most of the time when you go for a HPV test, that is what is going to be tested for. At 16, 18, some panels have others that include like 35, 36, and those would be the high-risk type of human papillomavirus. And they're responsible for about 70% of the cases. And we know HPV is kind of the most common sexually transmitted infection. The challenge with HPV, unlike HIV, which I think we all knew about, and we thank God that through all the activities by Ministry of Health, HIV prevalence has really, really gone down. But unlike HIV, if someone uses a condom, you can prevent transmission of HIV. HPV is a more virulent and it spreads more easily. So even condom use will not necessarily prevent HPV. So what does that mean? Is that almost 80% of women are infected with HPV, and even men. So majority of the population do actually have HPV. So the idea is their immunity. So people who get cervical cancer would have a lowered immunity for whatever reason, and that's why they progress to H. So it means that almost everyone, like we're now in this group, most of us at some point in our lifetime would have been infected with HPV, unless of course you're vaccinated. So what happens? This is just a diagram of when you have close contact. So normally it would be sexual contact. And when we talk about sexual contact, we're in an era of alphabets. I think what we call the LGBTQ, which Trump is, I think, has waged a war on. I'm a person in reproductive health, so we do not discriminate about anybody regardless of their sexual orientation. So it's even understanding, even with non-penetrative sex, for example, we have lesbians who, by virtue of how the reproductive tract is, they would not have penetrative intercourse. They can still spread the virus. Even things like you go for waxing. And I thank God that nowadays we use the disposable strips for waxing. We used to have the reusable strips that they used to use. It used to be a cloth that was washed. So if you have somebody who has HPV and you use the same thing, so your intimate things like towels, you can get HPV without necessarily penetrative sexual intercourse. So it's just understanding how easily the human papilloma virus spreads. So once the virus enters the cell, what is going to happen? It's going to infect the cells, and they're going to start replicating. And replicating means it's just dividing and becoming more in number. And as it replicates, it's going to, the other viruses are all going to infect the cells. And fortunately, this process takes a very long time. So over 10 to 30 years, you find that about 0.8% of cases are now going to develop cancer, whereby it has invaded all the layers of the lining of the cervix and gone into and past the basement membrane. So cancer is when you have any epithelium, so that is like skin or the mucosal surfaces, there's a layer which we call the basement membrane. If that is not breached, you don't have cancer. You'll have what we call a precancer. But once the basement membrane is breached with those cells, is now when you get cancer. As I've said, the main mode of spread is through sexual intercourse, and I think we've talked about that. And unfortunately, there are other risk factors. So you have populations at risk. So even though the seroprevalence of HIV has gone down, and we have the advent of antiretroviral treatment, those people who have HIV, and especially those who are not on treatment and have AIDS, are at higher risk of getting cervical cancer. Smoking and use of birth control for a long time for more than 5 years. That is the pill. I don't want to be a barrier to use of the pill, but this is prolonged use. And then multiple pregnancies. So those who have had more than 3 children are at risk of getting cervical cancer. And then you have those who have several sexual partners. Obviously, you also have those, we have still the problem of early marriage in our country. I used to work in Kilifi, and I think I had a 13-year-old come, and she's saying that she was introducing her husband. So you can just imagine. And family history of cervical cancer. Now, as we said, fortunately, cancer is a slow growing. The progression is quite slow. And we are able to detect precancerous changes before you actually get cancer. And that is what part of the prevention strategies include. So in terms, we need to either prevent, have early detection, and have treatment modalities. And that's what we're going to discuss. And we are very optimistic that over time, we will be able to completely eradicate cervical cancer, but it's going to require a lot of efforts from all healthcare providers and people like APA. And these are one of the ways where we're spreading awareness in terms of prevention and screening and treatment. So for cervical cancer itself, the most common symptom would be unusual bleeding. And this will be bleeding, especially, I think the most common is after intercourse, somebody reports that they're bleeding. Others have an increased vaginal discharge, and it usually has a very offensive odor. And you can have your bleeding is heavier than normal during your periods. You have pain during intercourse. Anyone who is menopausal and they have bleeding after menopause. So menopause means you've been 1 year, you've not had your period, and it's not because of any hormonal treatment that's causing that. And we consider that to be menopause. And then from nowhere, start bleeding again. That would require some investigations, or any unexplained pelvic or back pain. Again, just a diagrammatic representation of the same. So it's unusual discharge, loss of, and I think I didn't have the loss of bladder control. And in some cases, you actually get, in severe cases, when you have stage 4 and you have local spread to the surrounding tissues, you can even have that you're leaking urine, and worst case scenario, even feces is passing through the vagina. So it's a very debilitating disease, very uncomfortable. You have something like that, you'll find even people who are close to you and want to help you would actually even run away from you. Many cancers will be associated with clots in the legs, so what we call a deep vein thrombosis, and would usually present with pain in the leg, and of course, unexplained weight loss. So there's great news, and the great news is that we can prevent cervical cancer. And how do we prevent cervical cancer? We have different types of prevention. And in primary prevention, we are targeting people who have not yet been exposed to the human papillomavirus. Exposure normally occurs during sexual intercourse, and that is why our vaccination programs are targeted to girls 10 to 13, and that's what the Kenyan vaccine program is doing. However, any woman and even man can get the vaccine to prevent the spread regardless of their age. And but the younger you are, the more you get the benefit of using the vaccine. And again, no woman should die because of cervical cancer. Other than the vaccine, in as much as you can still contract HPV with use of condoms, it will still provide some level of protection. To avoid early, we had said that early sexual debut or early sexual onset of sexual activity would be a risk factor. So avoid that. Avoid having multiple partners. If you have a sexually transmitted infection, go for a prompt treatment. Avoid smoking. And we know there are also strategies on the male circumcision. It was seen from the Luo community, whereby we primarily were not doing the male circumcision. And we found our HIV and HPV spread was actually higher. And so strategies to ensure male circumcision would also reduce the bulk of cases. So that's what we're going to do for primary prevention. And we would want that our girls are all vaccinated. It reduces risk of HPV infection and spread by about 71%. That is a huge, huge, huge number. This was when our vaccine was launched. It was during the reign of our previous president, Uhuru Kenyatta. So this was the launch. And we've said, I think I've mentioned that anyone between the ages of 9 and 45 can get the vaccine. And it's recommended girls get it before the age of 12. And in Kenya, we're targeting girls, but it was initially just 10-year-olds, but they expanded to 10 to 13-year-olds. And even boys, if you want, in as much as the program is not covering boys, the boys can also get vaccinated. So secondary prevention. So secondary prevention, we said primary is before you have exposure to the human papillomavirus. So in secondary, you already have exposure to the human papillomavirus. It targets women above 30 years of age. And this is through regular screening. I must mention that even if you are vaccinated, it does not mean you do not go for screening. Even in vaccinated populations, you still go for screening because the vaccine does not target all types of HPV. The vaccine targets the most common types of HPV. So we have different types of vaccine. There are those which are against 2 types, which will be the 16 and 18, against 4 types, which will include 11 and 6, which is for warts. And then we have 1 against 9, which is very expensive, what we call an monovalent vaccine. And we had said there are 40 different types of HPV that can cause cancer. So that you are vaccinated, please, 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 still go for screening. You still use the condom use, and some of the primary still avoid multiple sexual partners, stop smoking, and proper treatment for the STI. In terms of screening, we have, I think, majority of us are aware what is called a pap smear. Then we have what is called visual inspection of acetic acid or Lugos iodine, what we call VIA-VILI for short. And we have the HPV testing. So in pap smear, I think women dread it, but I'd just say it's more of fear of the unknown. And unfortunately, some people have had a bad experience because we have to use something called a speculum. A speculum is something we use, and I'll show you a picture of it, to visualize the cervix. And it's quite uncomfortable to have that inserted. I also call myself the pap smear whisperer. So if you're really, really uncomfortable, most women who have had a pap smear with me will report they're like, oh, you're finished. They're not even aware that you have done the test. They're not as uncomfortable as what they expected. I'll just tell people that it's just to get the woman to relax as much as possible. The test will be uncomfortable, but it's not painful. So we look for changes. We collect cells from the cervix when we're doing the pap smear, and we look for pre-cancerous changes. So when you hear a pap smear, we're not looking for cancer. We're looking for pre-cancerous changes. So that is changes you get before you get actual cancer. And the beauty about doing that is that if we find them, we are able to treat you so that you actually don't progress to cancer. So please, please, please be champions of getting screened for cervical cancer. So at what age should we screen? So remember we've said that it's a slow progression. So even if you've had early sex, you're unlikely to have cervical cancer before the age of 21. So if you're under 21, we don't need to do any screening. However, in women between the ages of 21 and 29, we should do your first test at about 21, especially if, and remember we're talking about populations that are sexually active. And then thereafter, the minimum is every 3 years to repeat the pap smear. There are strategies that, and in women who you don't need to do a HPV test in a woman who's between 21 and 29. However, in women between the ages of 30 and 65, the screening schedule is similar, that you do a pap every 3 years, and you can add a human papilloma HPV test. If you do the two together, then you can reduce screening to once every 5 years. In women above 65, unless they've had an abnormal test, they again go back that you not necessarily need to go for screening. So this is just a diagram, and this is our dreaded speculum. So this is it, this metallic thing, but nowadays we have plastic, so it's a bit more user-friendly, not as cold, and a bit more softer on the tissues. And we insert that into the reproductive tract. We try to visualize the cervix, and this is the brush that we use, whereby we're collecting, we kind of like twist it to collect the cells from the cervix. Unfortunately, pathologists are not readily available throughout the country. The number of pathologists are not enough to take care of our whole population. So a lot of research went into this of, can we have, and meaning that a pap smear is very expensive and requires highly skilled personnel to give us a result. So a lot of research went into this, and we found that this is a screening strategy that is performed by nurses and other clinicians who are not necessarily doctors, whereby they're able to visualize the cervix, apply vinegar. Vinegar is very cheap, and it can be found anywhere. So that's acetic acid, that's the chemical name for vinegar. And when you apply vinegar and you have pre-cancerous changes on the cervix, we're going to see a white plaque. So it's a white like changes on the cervix where you have the precancerous change. We also are able to augment the accuracy of this test by adding iodine, what we call Lugos iodine. And with iodine, the same areas that turn white are not going to turn brown. They're going to remain yellow and not pick up the dye. And that we know these are areas that may have precancerous change. And these women are now referred for treatment, and in some cases, they're able to do what is called a see and treat. They're able to be treated immediately. So this is the vision of the cervix, and unfortunately, the white areas are not, so these are normal cervix, so you cannot see any white patches, and the iodine has picked up everywhere. However, if you have changes, so you'll see that these are white, what we call white changes because of the iodine, and with the with the vinegar, and with the iodine, you can see the same area is not picking up this brown, nice color. And because of this, we are able to, in rural areas and places where pathologists are able to screen women and offer them treatment. In terms of HPV testing, we are able to collect, like when we collect the pap smear, that same sample, we are able to use it to test HPV. So that's for your doctor. But we also have self-test kits. This was just an effort to increase probability of screening. Initially, it was a huge big brush. Now it's just a simple swab. You insert it in the vagina by yourself up to the level of this mark, and then you twist it about 5 to 10 times and put the sample in the bottle and take it to the lab. And voila, they'll do the test and you're able to get screening for HPV. So if a woman is positive for screening, we are able to offer them treatment. And I think I forgot to mention ablation. So previously we used to do cryotherapy. With cryotherapy, we're freezing the abnormal parts, or we could cut off what we call leap, remove those abnormal. So like you saw the white part or the yellow part with the iodine, we would actually remove them. Or we have what is called ablation. So with the opposite of cryotherapy, you now use a thermal ablation with heat. We burn those areas, or we can do what is called a cold knife. If you're very suspicious, we can just cut it out. And so that the advantage of cold knife is able to see the margins in case it's actually a cancerous lesion. Unfortunately, if our prevention strategies fail and somebody does get cancer, we have various stages of cancer. I think for this audience, is just remember that we have stage 1. All cancers vary from stage 1, 2, 3, and 4. And various cancers now have A1, A2, like that. That would be for my medical students. So in stage 1 of cervical cancer, it's limited on the cervix. Stage 2, it has gone from the cervix to other. So it has gone to the vagina, to the uterine body. Stage 3, it has reached the wall, so it's causing symptoms like you have difficulty urinating, you get renal failure. And in stage 4, you have metastasis. I think I talked about it. You have what we call near metastasis, when it has spread outside of the primary organ. And it can go, the near organs in front of the uterus is the bladder. So it has invaded the bladder, and the symptom could be you're leaking urine through the vagina. Or behind the cervix, you have the rectum, and unfortunately can be leaking feces in very severe cases through the vagina. Distant mets, it primarily goes to the liver. That's the most common place. It can also go to the lungs, can go to the brain, can go to the abdomen, can go anywhere. Treatment is always based on the stage. And early cancer, we are able to treat. I think I mentioned about patients who we've treated, we caught early. The people we are able to do surgery early, and it is actually early cancer, we will have removed all the tumor tissue, and they will remain tumor-free for the rest of their lives. There are those whereby you do debulking. Debulking means you remove as much of the tissue, but you're not able to remove all. So you find people like with a stage 2A, you may already have tumor in the lymph nodes. So if the lymph nodes are possible, are positive, they have to undergo radiation. Initially, they just used to undergo the radiation therapy, but we have found that if we add chemotherapy, it's normally with some gold chemotherapy components, we increase the utility of the radiation. So currently, the gold standard is we give some chemotherapy prior to the radiation. And I think with a very good results. When the era of multidisciplinary approach to care, so you find that the right person to treat somebody who has overt cancer would be what we call a gynecological oncologist. And I'm very proud that the current country is producing quite a number of the gynecological oncologists. And he would work in conjunction with, depending on the needs of the patient. Remember, they tend to bleed, so they would have anemia, you need blood transfusion. We talked about if they spread and there's blockage of the ureters and the adrenal failure, they need dialysis. You have some cases, even the dialysis, you're unable to do long-term where it's not accessible immediately. So you can have an interventional radiologist assist to provide a different route for the urine to pass out so that we can relieve the buildup of toxic material in the body, of toxins in the body. The radiologist obviously is going to do the radiation therapy. We have the medical oncologist who's going to help with the chemotherapy. You need a nutritionist, a palliative care team who are going to be in charge of the mental well-being and pain management in conjunction with the primary doctor. And as we said, the treatment is going to be multidisciplinary. I think with that, would have given you a very quick snapshot of cervical cancer. This is a bit interesting. So it's the second most common cancer for women. We again remind ourselves that it's caused by the human papilloma virus. We have over 600, sorry, this slide was a bit old and I didn't get my IT person to change that figure for me. So over 600,000 of new cases per year. Our symptoms was the bleeding, discharge, pain, pain during intercourse, bleeding after intercourse, risk factors. We talked about smoking, weakened immunity, even being overweight, relative to cervical cancer, and things like that. So resources, these were my resources when coming up with the presentation. And I'd just like to say thank you very much for your attention. And I'll hand it back to Zaina. And those are my contacts. Thank you so much for your very, very keen attention.
Thank you so much, Dr. Owiti. That has been a very, very educative session, and I believe our ladies and gentlemen have really picked quite a lot. I have a lot of queries for you here. I'll try to pick them because we still have like 20 minutes as much as possible. So what kind of cancer does HPV create in men?
Okay, so it would be penile cancer for men. And again, men seem to be more affected by the 611, which is the warts as well, which women also got, but they do get penile cancer because of HPV.
Thank you, Dr. Ria. What value would the vaccine have on boys and yet they are not exposed to cervical cancer?
Okay, so I think the previous question has answered the first question that men are also at risk of getting penile cancer and other pathologies associated with human papilloma virus. But the also is we're in the era of involving men in the healthcare of their wives, their sisters, their mothers. If majority of couples, I would say, are heterosexual, and we are saying that the spread is sexual. So if the person who you're getting HPV from does not have it, you will not get it. So that is the point. So men are also affected by HPV. They can get the penile cancer. And we are involving men in terms of preventing those who are close to them.
Thank you. You mentioned that, your slide came up as age target 45 and all that. 65 was the maximum, yeah?
Yep.
Why is it that women above 65 are not at risk?
You find that, as we've said, if by this time, what we are saying is that it's not that if you're 65, if you're 65 and you've been going through screening, and your HPV test is negative, your pap smear is negative previously, you're unlikely at this point to still develop the disease. Because I think even you realize 65, even your sexual activity has gone down. So that is why the screening program, you find if a woman, so it's if you've never been tested, you need to be tested. So I think maybe let me just clarify that. So somebody who has never been tested, you test. You test and find she is negative, pap smear is normal, and she's negative for HPV. You don't need to screen further because she's unlikely to develop any changes. Because remember we said it's going to take 10 years. If she's newly infected, it'll take over 10 years for her to develop cervical cancer.
They say oral sex could lead to throat cancer. How true is that?
Okay. In terms of that, it's understanding there are various types of cancers and even various types of diseases that would be able to infect those organs. So that is possible.
Thank you. They say that people with HIV increase the risk of cancer or renal failure. If so, what is the relationship between HIV and cancer and renal failure?
Okay, so let me start the direct correlation between HIV and cervical cancer. So remember we said that most of us are exposed to the human papilloma virus, but only about 0.8% of people are going to progress to cervical cancer, despite most of us being exposed. The reason is some majority, our immunity plays a role in having the virus, eradicating the virus from our system. Okay, so unfortunately, if somebody who has HIV, and not just HIV, especially those who have AIDS-defining conditions, their immunity is weakened, so they don't have the probability of eradicating the virus from their system because of their weakened immunity, and then thus progress to cancer of the cervix. In terms of renal failure is like stage 3. What happens of cervical cancer is, so I'll take it from the point of first the cervical cancer and then the HIV itself. In terms of the cancer, it becomes like a physical barrier and blocks the ureters. Now, the ureters is a small pipe that helps urine move from the kidneys to the bladder. Now, if there's a block, and especially on both sides, what does that mean? It means you are not excreting the toxins, you're building them up, and this is toxic to your body. And that is what we define as renal failure, when you're not able to clear. So you have things like urea and creatinine, and you have a buildup of that in your body. So it can be acute or it can be chronic. In cancer of the cervix, because it's a long-standing thing, could be chronic renal failure, and you need to be able to eradicate those toxins. And that's what hemodialysis does. It removes those toxins from the body. In terms of the HIV itself, it can be even things like the drugs. Some of them are toxic to the kidneys and would lead to that. So those are the various ways that you can get renal failure because of HIV and cancer of the cervix.
Thank you, Daktari. I think I'll give you 3 questions, then allow you to respond because I believe the response will be short. One, does someone with IUD at risk of getting cancer? That is one. If you have had hysterectomy, is it possible to get cervical cancer? And three, if one has fibroids, does it increase the risk of contracting cervical cancer?
Okay, so I think IUD, the IUD itself would not be a risk factor for contracting cervical cancer. However, why using the IUD? It's because you are having unprotected intercourse to prevent pregnancy primarily. We have agreed that human papilloma virus is spread through sexual contact. So anybody who is having not using condoms, and as much as I've said that using a condom may not necessarily prevent, but it will reduce the risk of contracting the HPV, you are still at risk of getting the human papilloma virus. So if you have multiple sexual partners, it would not, the IUD would not protect you, but it would not increase your risk of getting cervical cancer. I think the second one was about a hysterectomy. So it depends on what was the reason for the initial hysterectomy. So if the reason was, say, fibroids, I think I'm going to answer the two. Fibroids not increase your risk of getting cervical cancer. So say you had a hysterectomy because of fibroids. I think anyone who has gone through that procedure will tell you that their doctor insisted that they had to do a pap smear before they did the surgery. And that's just to make sure that we're not missing any cancerous tissue before surgery, so that we have a good scope of surgery. In fact, any hysterectomy will do, for whatever reason, we will have a pap smear, at minimum, a pap smear done prior, just in case there's some problem, so that our margins for what we're going to remove, we're going to increase, and the scope of the surgery, we're going to increase. So if the pap smear was negative at time of a hysterectomy for fibroids, you are unlikely to get cervical cancer. However, human papilloma virus can still be responsible for this vaginal cancer, this cancer of the vulva, but those are rarer cancers than cervical cancer. However, if the reason for the hysterectomy was cervical cancer itself, and if unfortunately the margins at time of surgery were not clear, you'll find that the disease is still going to progress. I hope I've answered the questions. Thanks.
Thank you, Daktari. This question goes to APA Insurance, and I'm happy with us on board. We have our Chief of Staff, and it goes to her with consideration. APA should then increase age limit for women from 60 to 65. And I believe Irene has noted that, and she's going to keep it in mind. So what is the relationship between urinary tract infection, HPV, and cervical cancer? Is there any relationship?
Okay, so I'd say a UTI, not necessarily, because a UTI, anyone can get a UTI, whether they're sexually active or not. So it's why you didn't see us talking about UTI as a risk factor independently for cancer of the cervix. However, a common cause for UTI can be sexual intercourse. So even we always make fun of newly married couples. We have something called honeymoon cystitis. In honeymoon cystitis is a newly married couple, especially if the girl is a virgin, they tend to get urinary tract infections. And remember, we have said that the spread of HPVs via sexual contact. So it's just because of it could just be something that's coexisting, but it's not that the urinary tract infection is causing the HPV infection or cervical cancer.
Daktari, as probably you respond, somebody has requested if you can display the slide with ages recommended for pap smear. I think I You had such a slide on? And then as you display the slide, what is the probability of the other HPV infection apart from 16, 18, and 45?
Sorry, just repeat the question.
What is the probability of the other HPV infection apart from 16, 18, and 45?
Okay, what we have said is that for more than 70% of cases of cervical cancer as because of HPV, what do you call it, HPV 16 and 18. So it means all the others would account for 30. I don't have the disaggregated data for, I can't remember it offhand for the other types because it's mixed. We have concentrated mostly on 16 and 18 because they are the most common and the most oncogenic. I hope they're seeing the slide.
Yeah, we are seeing the slide, Daktari. I think our viewers should be able to see that clearly now. The ages. Is it too late to vaccinate a boy of 17 years? Because
Okay.
I am not sure if they are already sexually active.
Okay, so what we have said is that the person who's going to benefit the most from the vaccine is somebody who is sexually naive. Yani has not had any prior contact with human papillomavirus. Okay, so however, it has been shown, and I think we said even women up to the age of 45 can still get vaccinated. So the same would be for the boys. It's just from a public health perspective, it's expensive to vaccinate the entire population. So from a public health perspective, you do what is like the Pareto principle. You concentrate on where you're going to get more wins. So women are the ones who are suffering from cervical cancer. It's much, much more prevalent than penile cancer. So it would benefit more by vaccinating those who are going to be directly affected by the disease. But if money is no object, the same would apply for our men. So even up to 45, regardless of, or even, and I think for men, even above, because remember, a 70-year-old man can get a manyanga for a girlfriend or a wife. So by treating or preventing the person, the better. But you find the older you are, the more experienced we are in terms of sexual activity, the more likely you have the HPV and the more likely you are to spread it.
Thank you, Daktari. I'm a lady of 50 years, never involved myself in sexual activities. Should I go for the test? And is it a myth or the test would break my virginity?
Okay, so there is good news. And I think, I don't know which direction it was. I think it was here. Which was primary, sorry. I'm looking for the. Just 1 minute, I'm getting something for you. Someone has stolen my mouse pad at nikimwangalia. So if you look at these two pictures, you have the top picture whereby it's a tiny swab for the human papilloma virus testing. So in as much as we were very clear that majority of cases of cancer of the cervix is transmitted via sexual contact, but we said you can still get the virus through non-penetrative contact. So you've gone for waxing, you've gone, I don't know, you shared underwear, I don't know, swimming costumes. Like I remember like in school, if you forget your costume, you borrow your friends or somebody, I don't know. something like that. So there's no harm in terms of testing. So you don't necessarily have to have a speculum. You just insert this tiny swab. We do a HPV test. HPV test is negative. You're not likely to have any changes regarding to cervical cancer. And with this, we don't necessarily need to break your virginity. However, if you're to have a conventional pap smear collection this way, unfortunately, this would be very painful and we would be breaking your virginity. But it's also, remember, it's the physical, and if you say physical hymen, that you have not had intercourse, you're technically still a virgin.
Thank you, Dr. I think I may have to cut off the questions because of time. We will be sharing our email address on for you to be able to forward your questions, but I'll give maybe one or two. Is getting married early a risk of getting cervical cancer? That is one. And is race still, a challenge, or does race, black skin, white skin, does it expose you more?
Okay, so how to put it? So getting married early, yes, is a risk factor. So it's understanding, remember, it's the longer the duration of exposure, okay, the more the likelihood. So when you get early, you have a longer duration of exposure. So it's people with early marriages and multiple sexual partners. Regarding race, it's not the race per se. It have been put the race, but unfortunately, you find incidences of certain disease has a very big correlation with socioeconomic status. And you find things like HIV, which we said has a very, very big relationship with getting cervical cancer. Unfortunately, on the indices for HIV, Africans seem to be adversely mentioned, whereby our rates of HIV are higher than in non-African populations. So because of this, you find the incidence of HIV is higher. I'm sorry, of cervical cancer would be higher and would be more at risk, but not necessarily because of the race per se.
Thank you, Dr. Now, there's one more question. If VIA/VIN is found positive in a 65-year-old, what does that mean?
Okay, so if VIA-Vili is found positive, it means she's having changes caused by the human papilloma virus, and she would then need to go for further testing and most probably treatment. So the next step is we do the colposcopy, whereby we now get a biopsy from those areas that have a change and confirm whether it's a serious precancerous change that needs treatment or whether it's nothing to worry about.
Okay, I have a viewer asking if APA covers the HPV vaccine. I'm not sure whether you joined earlier on, but when we began, we talked about the Femina plan, whereby you're covered for all those tests and you're covered for vaccines. So if you're under APA, you want to be covered for vaccines, kindly join our Femina Plus. Then you'll be covered for all the, the vaccines that pertain the cancer of the cervix and the other risk factors. Now, can women/girls below 21 years be tested? Since I'm dealing with community where girls are exposed to sexual activity at an early age, as early as 15 to 20.
Okay, so if anyone who has undergone, who has started sexual activity can have a pap smear or HPV test. And remember, we've said even the virgin, they're able to do the HPV test. So yes, the answer would be yes. And we would encourage. However, if they are under 21, remember we've said they don't need testing, because remember we've said progression of the disease is very, very slow and takes a very, very long time. So they don't necessarily need screening. What we would recommend in that population is they get vaccinated despite the sexual activity.
Yeah, I'm on ARVs and I would like to have the HPV vaccine done. Is there any, will it add more risk or will I be protected? What would you say, Dr. about that?
I think we should look at it in HIV programs because one of the biggest challenges we've had the vaccine, and I think the first batches even had to be destroyed because the uptake of the vaccine is very, very low. Unfortunately, the screening program was targeting girls 10 to 13 years. And I think that's a very eye-opening question. There's no contraindication for being HIV positive and being on treatment to getting the vaccine. Such a person, we would recommend we probably screen first. And regardless, just to find out, as long as there are no precancerous changes, you would benefit from getting the vaccine. So would strongly recommend to government as part of policy because we see very, very many cases of cervical cancer in patients with HIV that they, in their program, what they do have is a lot of screening. Why can't we add vaccination as part of their treatment in this group? Because I don't see any reason, if your PAP is normal, why you shouldn't get a HPV vaccine.
I'll take this question as the last one, and I'll be posting our email address so that the rest of the questions can come over. Then we will be sharing them with Dr. Maureen, and she should be able to respond to you as per your email requests. This is, does the issue of multiple sexual partners apply to both men and women? i.e., if your partner has multiple sexual partners, does that put you at risk of contracting HPV?
The answer would be yes, especially for women. Unfortunately, our reproductive tract it does not protect us. Men, the way their reproductive tract is made actually protects them from a lot of things. So that could actually be a challenge. I saw an interesting question about 30. So we've said anyone up to 45 and even above, depending, could still get the vaccine. And yeah, so I think prevention is always better than cure. I'm very happy that APA have started a special product for women that focuses on prevention. So, and regardless whether you take on that, please, let's get vaccinated, let's get screened.
Thank you, Dr. Ari. Since adults can get the HPV vaccine, will it cause any disease progress in case you are unaware that there's a cervical cancer already?
Okay, so as we've said, primarily when we are getting the vaccine. So you have, say, our target group between above 21, sexually active. It would just be good practice. Have a screen. It's negative. Get the vaccine. You have a screen. We pick up changes. Get treated.
Daktari, I'm being asked where you can be located, where you can be found.
Let me share my screen again.
So that people can reach you. How can someone join the Femina Care Plan? I'm actually responding to you on that. You can send, and there are many others of us who would want to join this plan. You can send the name Femina, as Daktari shares her screen, Femina, to the number on the chat on 0720-760-577. Kindly send the name Femina to the number on the chat 0720-760-577. So that somebody will be reaching out to you to guide you on how to pick this up. Now, Daktari has shared where she can be found. Dr. Maureen Owiti, Gyna Care, 40 Suite, 7th floor. Room 709, Hospital Road, opposite Nairobi Club. It's actually behind the traffic headquarters. Daktari, we want to appreciate you this morning. We know your students have had to wait for you to finish this and your patience, and we are humbled that you could create time to join us on time and to be with us. We really appreciate. And to our viewers, on behalf of the APA management team, the medical team, on behalf of the head of health, David Mumo, the head of care team, Jemima Mbugua, the head of retention, business development, underwriting, Charles Mbugua and Samuel Mugeke. On behalf of all of us here at APA, we really appreciate your presence and we don't take it for granted. So without holding you anymore, I would like to call this session to an end. Please have a blessed week. We will be holding more webinars every last Friday of the month, and we'll keep you posted. Keep on sending your questions to the chat and to the email we have shared. Karibu sana, see you next time.